Welcome to Hiranya Medical Service. 5 minutes to a better health by our eminent doctors. Let's look at today's topic.
Hi, this is Dr Sujatha Rajnikanth from Velvom, a women's health and cancer care center located in Chennai. I'm happy to be part of the awareness series by Hiranya Medical Service. Hiranya Medical Service was created by a second year medical student, Hiranya, and her parents with the aim to increase awareness, educate public, and reach the unreachable. They started with Live a Smart Life series by doctors. They have also supported India during the COVID times with PPEs and oxygen concentrators, and also conducted a webinar on sickle cell disease. Their next series, called 5 Minutes to Better Health, by doctors on health topics to create awareness, and I'm happy to be part of it. My startup Velvom is a specialty breast clinic, preventive oncology clinic, and a tobacco cessation clinic, also aiming to provide affordable cancer care, and it is located in Mogaper, Chennai. And I cater to all breast needs, benign and malignant. My talks in this series will be about breast health, common breast issues, and breastfeeding. I thank Hiranya Medical Service again for organizing this talk and giving me the opportunity to share my expertise and contribute to increasing breast awareness. Basic breast health and awareness about your breasts. What is important in this? So the breasts are basically secretory glands that are located in your skin, something similar to the sweat glands and the fat producing sebaceous glands. Breasts are similar glands, and the breast is basically composed of, on the left you have a normal breast. It is basically composed of fatty tissue with interspersed fibrous tissue to hold it in place, glands to produce milk, ducts to carry this milk to the outside through the nipples and the areola. And this is sitting on your chest wall. It doesn't have any bony structure or any support that can hold it up on its own. Now, any of these components can become abnormal, producing the various symptoms that we usually associate with our breasts. And these symptoms can be something as normal as the fibrocystic changes, or it can be a cyst or a fibroadenoma or a tumor or an abscess or even a cancer. So the first and most important aspect in breast care is wearing the correct bra. So the breasts, like I explained, do not have any muscular or bony support, and wearing the right size bra goes a long way in both maintaining your posture, your spine health, and more. So I see many women in my clinical practice coming with lots of pain, like upper chest pain and back pain and postural deformities, and most of them are not aware of the correct bra size to wear. So measuring your chest as well as your breast size and getting the correct bra size and wearing them goes a long way in supporting your spine health and your confidence too. The next important thing is self-examination of your breasts. So this, every woman from 20s onwards needs to do this regularly. And this needs to be done the week after your periods and not before your periods. Because before your periods, due to the various hormonal changes, you might have noticed some amount of pain, discomfort, and tenderness, and unable to wear your clothes or the bras, feeling uncomfortable. So, whereas after your periods, all these hormonal changes are down, your breast feels soft, manageable to touch. So, self-examination is done after you start your periods. So, you first examine them by standing in front of the mirror with your hands on your hip, raising your hands up and down, making sure the breasts move up and down together. A small difference in size between both breasts is expected because your right and left side of the body are not exactly the same. If there is a sudden remarkable change in size between your right and left breast, then it calls for checking with your doctor. And then you do the examination with the palm of your hand. You do not cup or hold your breast. You use the flat of your hand and run it in all directions, circular fashion, top to bottom, or from outside inwards. And the idea is to get familiar with your breasts and not go looking for lumps. When you do this regularly, if you notice anything different from your previous examination, then it is time to see your doctor. And this can be done even once every 2 or 3 months, the week after your periods, and you don't have to do it every day or after every cycle too. You don't go looking for nipple discharge. If there is any unexplained involuntary discharge, which could be either bloody or milky or watery, you can go meet your doctor. So this is about breast self-examination, and this should be started from women in early 20s to well into their old age. Now, if you do find a lump, what do you do next? When the questions you ask yourself is, when did you first notice it? Is it growing? Is there any change in size? Is there any pain or associated with discharge? What is the relation of this lump to your periods? Have you had any previous breast lump, lesion, cancer? Personally, personal history, and similarly your family history. Has there been any history of breast cancers or breast lumps, or has anybody else in the family had similar symptoms? And this will kind of put your mind a little bit at ease before you actually panic, and either you don't go for a checkup or you rush into a checkup. Ask yourself these questions. This should be followed by what is very important, also called as the triple test. So you, with self-examination, have found out some issue. So once you go to the doctor does a clinical breast examination, which is the first step, followed by imaging. If you're 35 and above, an mammogram, X-ray mammogram is called for, where the breasts are placed between two plates and an X-ray is obtained of the breast tissue. If you're below 35, because the breasts tend to be a little dense, ultrasound is indicated. And if anything suspicious is picked up in either the ultrasound or the mammogram, a biopsy is advised, and an ultrasound guided biopsy is recommended. It could be either a fine needle aspiration or a true cut biopsy. Very rarely an excision biopsy might be called for. So the clinical breast examination, imaging followed by biopsy is what is known as the triple test. Now, what are the risk factors for breast cancer? You have modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors is if you have a racial or a genetic risk for breast cancer, which cannot be modified. Similarly, the fact that though men and women can get breast cancer, it is more so in women. So your gender cannot be modified. Though breast cancer occurs at all age, it does occur more frequently as you get older, and again, aging cannot be modified. Whereas factors that can be modified include staying physically fit, eating a healthy plant-based diet, limiting or avoiding alcohol and tobacco, avoiding unnecessary chest radiations, and maintaining your ideal body weight. Obesity is in itself considered an independent risk factor for breast cancer. So some of the symptoms of breast cancer, a lump does not immediately mean breast cancer, but it can hint towards something abnormal which needs to be looked at. Any skin changes, discharges from the nipple, all these can possibly hint towards breast cancer, but again, do not presume that it is something dangerous and avoid seeing a doctor. Immediately going and seeing your doctor, breast specialist especially, makes sense. There are loads of myths related to breast cancer. That is, if you find a lump, it should immediately mean cancer. No, 80% of the time, the breast lumps are benign, non-cancerous. Only if there is a family history, you get breast cancer is also a myth. Any woman can get breast cancer, and 70% of the breast cancers are non-familial. Again, only as you age or only women get breast cancers are myth. It can occur at any age, and men can also get breast cancer. Wearing bras, sleeping with bras, wearing underwire bras leading to cancer are all a myth. Using deodorants and antiperspirants causing breast cancer is also a myth. Again, repetitive mammograms cause breast cancer is also a myth, because mammograms are recommended once a year and the amount of radiation is very, very negligible. So quickly to run through your breast smart timeline, wear the right size bra. If you're younger than 30, start doing your breast self-examinations. If you find anything abnormal, immediately go meet your breast doctor to get it checked. Between 30 and 39, a clinical breast examination is recommended, along with continuing your self-examinations and seeing your doctor if you find anything untoward. 40 years and above, annual mammograms are recommended, along with the clinical examination, as well as the continuing the self-examination and talking to your doctor again if you see any breast changes. Thank you, Dr. Sujatha Rajnikanth for Velvom.
Thanks for watching. Do like, share, subscribe and click the bell icon button to receive instant updates.